Welcome to the training for healthcare professionals. Let's begin with the module which focuses on assisting patient to dress. Let's take a look at the key learning objectives. After completing this module, you will be able to explain why patients need assistance for getting dressed or undressed, assist dependent patients to dress or undress. Why do patients need assistance to dress? Click each image to know why patients need this assistance. For patients with limited mobility, they may have difficulty in dressing or undressing. Post-operative, injured patients or patients with broken, weak limbs. They can hurt themselves if they are left to dress or undress independently. For weak or dependent patients, they may not be able to dress or undress independently. Let's find out when a patient needs assistance to dress. When a stroke or any other severe medical condition weakens one side or the whole body of the person. As a routine activity, undress before bed bath or assisted bath and dress after bath. In case of sweat, spill, contamination, etc. Whenever requested by the patient. Let's find out what we understand by patient clothing. Patients may have preferences or cultural beliefs that influence what they would prefer to wear in hospital. Click the image to know about factors to consider when dressing patients. A few factors to consider when offering patients choice of clothes: duration of hospital stay, mobility of the patient, the provision by relatives or friends of suitable clean day wear if permitted, patient comfort and well-being, nursing and medical procedures that the patient is likely to undergo during their stay in hospital. Item checklist. 1. Gloves. 2. Patient clothing, gown, undergarments, socks, etc. 3. Powder or lotion if needed. Match the image with its label. Drag and drop the label against each image. Let us understand how the procedure is done. 1. Preparing the patient and undressing. 1. Wash hands and wear gloves. 2. Greet the patient. 3. Explain that you are going to assist him or her in undressing or dressing. 4. Close the curtains to maintain privacy. 5. Start undressing the patient on his or her weaker side first. Encourage independence wherever possible. 6. Put away dirty clothes in the appropriate place. 7. Dispose the gloves and rinse your hands. 2. Dressing. 1. Wash hands and wear fresh gloves. 2. Guide the patient or begin dressing the patient from their stronger side first. For example, if the patient is stronger on the right portion of the body, ask him or her to put his right arm in the right sleeve first. Encourage the patient to do as much on their own as possible. 3. Be around and keep the patient from falling. 4. Offer to apply talcum powder or lotion if needed. Now let us see a demonstration on assisting patient to dress.
Preparation and undressing. Wash hands and wear gloves. Explain to the patient that you are going to assist him or her in undressing or dressing. Close the curtains to maintain privacy. Start undressing the patient on his or her weaker side first. Encourage independence wherever possible. Put away dirty clothes in appropriate place. Dispose the gloves and rinse your hands. Dressing. Wash hands and wear fresh gloves. Begin dressing the patient from their strongest side first. Encourage patient to do as much on their own as possible. Be around and keep the patient from falling. Offer to apply talcum powder or lotion if needed.
Points to remember. Close the door and draw the curtains when undressing and dressing the patient. Keep the room warm and make the patient feel comfortable. Do not rush through the process. Take your time. Be gentle in your movements and pull the clothes and not the patient. Ensure that you don't sprain or hurt any part of the patient's body while dressing or undressing.